Hi, everyone. It's Dr. Z, and welcome to another episode of Next Up Narcissism. Today, we have the brilliant Dr. Ingrid Clayton. Dr. Clayton is a writer and clinical psychologist in private practice in Los Angeles, California. And she is the author of 2 books, almost 3. Her first book, Believing Me, Healing from Narcissistic Abuse and Complex Trauma. In addition to recovering spiritually, achieving emotional sobriety in your spiritual practice. And her newest book coming out September 9th, which you can now pre-order, Fawning. Dr. Clayton has a holistic approach to psychotherapy, incorporating trauma-informed modalities like somatic experiencing, EMDR, and other experiential ways of working with the nervous system. In this episode, Dr. Clayton and I dive into her new book, Fawning. We also talk about patterns of fawning, what they look like, and more importantly, how to heal from them and how it relates also to complex trauma, whether it's something you experienced growing up or something you experienced later in life. Dr. Clayton is a wealth of information, and I think this is going to be extremely helpful, especially for those of you who find yourself kind of losing the sense of who you are, what your value systems are, and even things like what your interests are, things that are lost along the way when you're in a narcissistic abusive relationship or a toxic upbringing of any kind. Hi, everybody. Welcome to another episode of Next Up Narcissism. Today, we have the absolutely brilliant Dr. Ingrid Clayton with us, and I've been waiting patiently to have you on. You are absolutely brilliant. Love how you explain things to people that are going through stuff that they don't understand, right? And so I think you really do an excellent job of talking about trauma, what it looks like, fawning, which we'll get into, complex trauma, and you put it in a way that is just kind of, you give these bite-sized pieces that people can really understand without kind of the jargon and psychobabble that I think things get lost when we talk like that. So Dr. Clayton is an author of almost 3 books now, right? Your third one's coming out. This was your second or first, Believing Me, and then your new one, Fawning, which comes out September 9th, but it is available for pre-order, and we will have all the links in the show notes. But Ingrid, I'm going to hand it over to you. Just kind of give a brief overview of who you are and your wonderful work, and then we'll get into it.
Thank you, Jaime. I'm so happy to be here with you today. Yeah, it's been a long time. We've known each other online. And, yes, I'm a clinical psychologist. I'm a trauma therapist. But what I always say is that really I'm a survivor, right? A childhood trauma survivor or complex trauma survivor. And I lead with that. I think lived experience, the way that even when I work with my clients, I say, I've learned more from them than any other training, essentially, right? So I like connecting with this really intense material from a very personable place, and even sometimes a humorous place, because I think we have to laugh a little bit in order to survive some of these things.
Yes, don't we?
Yeah. My memoir, that was my, it is just a straight ahead memoir called Believing Me, Healing from Narcissistic Abuse and Complex Trauma. And that was really what set me even deeper on this path. I was a trauma therapist before I wrote that book, but I was not a trauma therapist who identified as a trauma survivor, because Jaime, my experience wasn't that bad. I mean, come on. I know, compared to so many people, like what happened to me. So I identified with that idea where we have like a trauma measuring stick, and it's about the event. It's very specific, and it's like, oh, that thing didn't happen to me, so clearly I must not have trauma. And yet what we know now is that trauma is so much bigger, wider than our original perception of like this acute, specific event that everyone can agree is traumatic. In fact, complex trauma is about prolonged experiences over time, these like maybe, these cuts to your psyche over and over, day in, day out. And that what we know whether that's childhood trauma or what we sometimes call developmental trauma or long-term abusive situations, it has the same impact on your nervous system as these acute events, right? So you can't really enter into this thinking about the event necessarily. It's more about, what are my symptoms? What are my symptoms today? That's what allows me to know if I have unresolved trauma. It's what I'm living with now. So I wrote this book, my memoir. It took me about 5 years to unpack it all. And finally, one day I could look back at my own story through a trauma therapist's eyes and go, I have complex trauma. That's what this is. And once I could name that that's what this is, I could avail myself of the tools that we have for working with trauma, which is very different than the tools that I've availed myself of my entire life. I did all the things and wondered why I was still stuck. So that's sort of the nutshell version of where I come from and why I'm so passionate about this work, because it's the one thing that after decades of trying, that's allowed me to make sense to myself. And I just want other people to know that it makes sense too.
That's right. And, for people that are listening that are going through this, we talked about this before we hopped on, that these kind of complex traumas that occur, right? It's, as you said, these kind of tiny paper cuts along the way, but not so much the event. If you measure it, like you said, with the event itself, everything's relative. I always tell people, right? And no matter what it was, there's always somebody, quote, on paper that may have had it worse or not as bad or whatever the case may be. But what's important is how you personally respond to the trauma, what support network you had while you were going through it, what your coping skills were. A lot of our responses, which we'll get to with Fawning, are survival tactics. And, they work for us at a certain point, but then as we get older and we're out of that context, but we're still using those same skills. So I think it's more, along the lines of what you said, that it's more about how our symptoms and how the way we view the world and how we view ourselves in relation to the world, how does that interfere and to what extent does that interfere with our daily functioning? And I'm very big on, telling people it's not so much even sometimes about the emotion, it's the degree to which it's preventing you from living a fulfilled life. And I think that is so important. And I don't think it's talked about enough. I think people think that if it's not that bad, then they don't have the right almost to have these trauma responses. And I think that's where the shame and the guilt and the self-comparison comes in. And it just creates this very heavy feeling to just pull yourself through.
Yes, you're absolutely right. And I think the thing that gives you access to knowing that you have trauma responses is that you have a body, right? So I even say that too, in terms of I've done all this work and now I've written, multiple books on the subject. I am going to get triggered. I'm going to turn towards fawning. I'm going to do it all 5 minutes ago and I'm going to do it again tomorrow. Like, I'm not going to override the fact that the human condition exists in this body, this nervous system that experienced everything that it did. But to your point, we're not meant to live in survival mode all the time. We're not meant to live with our trauma responses in the driver's seat. And what we know is that a lot of us who experience this long-term pervasive threats to our safety, our trauma responses are in the driver's seat and we don't even know it. We think, this is just my personality. This is who I am. Quite frankly, a lot of us are just trying to meet expectations, doing what was asked of us. And it gets confusing because somewhere along the way, we go missing in our own lives and we don't even know it.
I love that. I love that. Yes, correct.
Yeah.
I love that. I've never heard it put that way. And I love that.
Yeah.
You go missing. But you don't know you've left the building.
That's right.
Right?
Yeah.
We saw that. I'm sure you saw this in your practice too, as a psychologist, after COVID, right? Everybody kind of came out of it. Everybody was foggy. And one of the things I kept telling people was, we are not equipped as human beings to be in fight or flight mode for 2 years. We're just not. We're exhausted. We're tired. We're foggy. And so, like you said, our bodies just at a certain point, they just stop functioning as well as they could be, but we just kind of think that's just how it is. And for people that have had these long histories of trauma, sometimes they're not even aware that there's another way to feel, not just emotionally, but physically also. They've always been in chronic pain. They've always had stomach issues. This is them, and it doesn't need to be. So one of the things that was, I think this was in your other book, but it stood out to me, and it leads kind of into the fawning discussion I want to have. And it really said, it kind of was one of those things where it hit my stomach. I'm like, oh gosh. But you had talked about the concept of codependency, and the idea of enabling, and how when you were trying to make sense of what was going on in your world and in life, that the idea behind enabling and codependency wasn't just ineffective in explaining, but it was insulting.
Yes.
When I read that, Ingrid, it literally hit me somewhere really, really hard in my gut. So I just wanted to kind of use that as a jumping off point for fawning. And can you talk about that a little bit? Because that resonated so much with me, and I'm sure it's going to resonate with a ton of listeners.
Yes. Well, so just to define fawning for a moment, and then I can backtrack to some of these other terms. It's a relational trauma response, right? Just like fight, flight, or freeze, but it's a relational response where you manage, your perception, you do caretaking, you kind of appease, you lean into these relationships that might be causing you harm because you're dependent on them, because we all live in hierarchies and structures of power. And, we live in the world, we live in this body, but we also live in the world in these relationships, and we're dependent on people. And so if I need you to take care of me, but you are actually, an alcoholic or toxic or emotionally immature, and you can't even take care of yourself, this fawning is a very adaptive response to a dysfunctional relationship or environment, right? So this idea that we turn to people and we say, well, you have a disease, or we say dis-ease, but this disease, or you just need to grow your self-esteem, or why don't you just set healthy boundaries? Why would you care what someone thinks about you? We're applying these very conscious and rational ideas, right? As though our reflexive trauma response was conscious, or that it wasn't sort of reflexive and adaptive. So first of all, there's a huge gap there, right? We're applying these conscious solutions to an unconscious strategy. And then we're removing them from the context. So the idea behind what we've long referred to is codependency and people pleasing as this like personality flaw, or something is wrong with you. It's never honored the origins. And so what I love about fawning is it puts our behaviors in a context that, again, allows me to make sense to myself, because I go, first of all, I have a body, I have a nervous system, just like the animal kingdom. You would never see an animal in the wild who bolts when it's threatened and go, is that guy overreacting?
Right. Yes.
You trust that it experienced threat and its body turned to the response that was both available and most likely to get that animal out of harm as quickly as possible. We also have this same nervous system in our bodies, right? And so often for folks who don't have a fight response available, because for a lot of us as children, as women, as people of color, fighting makes it worse. That's not going to get you out. Again, think about a child. They can't run. Where are they going to go? Right? So fawning at the end of the day becomes the most adaptive response to managing harm in the environment in which you're living in. And I go, that's genius. I did not have a low self-esteem problem. I had a genius body that was doing anything it could do to keep me safe in the moment. And I am grateful for it. Okay. So we have to start from there, and only from there, right? Because it reduces the shame. It reduces the shame, and we go, oh my gosh, of course I have a fawn response. And am I still in a dangerous situation, right? There becomes, over time, we do have to start to discern, is this discomfort or is this danger, right? Do I need to chronically Well, just to say, if complex trauma is prolonged, ongoing experiences of trauma, it makes sense that fawning becomes a prolonged, ongoing experience of keeping ourselves safe. That's the other reason why we start to go, is this a trauma response or is it just me? It's the water that we've swam in our entire life, so we can't really discern. But as we're coming out of it and we start to get curious and embodied, maybe for the first time ever, there is an opportunity to move this needle, not out of a need for a threat response all the time, but to where we don't have to live there 24/7. That's the goal, right?
Yes. Yes.
Yeah. I said a mouthful there.
No, I just let you go. I mean, it's so the way, that's what I'm saying. The way you phrase it is so relatable. And it's just dead on. I mean, I always like to tell people too, it's kind of along the same lines that the shame and the guilt and the I should have done this or I should have known better, your body did, and your brain did what was best to keep you alive, right? We are wired for survival. And so we're going to do what we need to do to be able to survive the situation. And when those patterns continue into adulthood or just continue in a non-toxic or a safe space or a safe situation, but yet we still use those same patterns without understanding the origins, like you talked about, you have no frame of reference and you just think something's interpersonally flawed with you or something internally is flawed with you. You need to fix it. And while, yes, you need to understand it and change patterns. Yes, we all do to some extent, right? The fact that you are like that because it's your fault, I think is where a lot of people get confused. It is not your fault. Clearly, the trauma is not your fault. Your response to it, though, like you said, when you were younger, was brilliant.
That's right.
Period.
That's right.
That's it.
Yeah. So it's very adaptive initially. It can become maladaptive. And that's why people go, well, what's wrong with me? Why am I repeating these, toxic relationships? Or why can't I, hold on to a sense of myself? That does become maladaptive. But if you don't see the origin story first, you're stuck in this loop of I'm broken. And we have a rational thinking brain. We go, of course I want to set boundaries. Of course I want to do these things, but these things do not feel available to us. And that is the rub. That's where we start to go, why can't I just?
Yes.
Because we want to so wholeheartedly. And if you don't look at it through the lens and language of trauma, you don't understand. You can't because your body is too triggered.
That's right.
Right. So,
and we end up engaging because that is so scary and so difficult, or we don't even know where to start. It ends up being easier because it's more familiar to engage in those same patterns over and over again because we are experts at those patterns, right? And so to break out of that, quote, illusion of expertise, if you think about it that way, and to start to try different patterns, it's really scary, especially if you're still within the dysfunctional system, but you've kind of, I use the fish in the fishbowl thing. If you've been out of the fishbowl, but then you go back in, now you have that objectivity you didn't have before. And so now to change your patterns still within the system of dysfunction with the pushback and the gaslighting and all of that is really difficult. So for fawning in particular, what can you give some examples, kind of real world examples of what that may look like as an adult, let's say, even, with a work colleague or in a relationship or with your children or with your own parents? Like what can fawning look like? So people listening will say, oh, wait, I do that.
Yeah, I think because it's so individual and it's dependent on your body and the context, it's always going to look a little bit different. But some common signs and symptoms are fawners tend to get small. We shrink. Our voices might get softer. We don't want to take up too much room. We don't really assert ourselves and have opinions. other people or institutions or communities loom large because we're managing that in order to find internal safety, right? That's how we go missing. That's how we self-abandon, essentially, is I'm not interested in what I'm feeling and how I'm doing, right? That's the piece that gets small. I'm interested in what you're doing and how you're feeling and how can I be helpful? How can I manage that? How can I make you safe so that you can validate me? You can give me permission to exist in the world, right? So there's this imbalance there. Along those lines, you can think about if we're constantly looking to the external environment to make sure that we can take care of business so that we can be safe. We're hypervigilant. We're anxious. But a lot of fawners don't know that we're anxious.
Yes. And they probably feel safe when they're not anxious.
That's right. So sometimes I've heard people refer to this as I'm an empath. I'm just really sensitive, right? I think a lot of empaths are at the core fawners who learned, again, that very adaptive behavior. You can walk into a room and you're like, I know what you're feeling. I know that you're in a bad mood. I know that you just had an argument before you walked in the door. We intuit. Our intuition is so finely honed. And here's the thing I say, when we sort of unfawn and you get some healing from complex trauma, you retain the gifts that were accumulated along the way, right? So I don't want to be hypervigilant all the time, but do I love that I have this sense of deep empathy that I can read my clients the second that they log on to session? I'm like, oh, I know something
from the first phone call, right?
So a lot of us wind up in the helping professions. Let's be honest. So these are some of the the cluster of symptoms, but I think what underlines all of them ultimately, sadly, is this self-abandonment. If there's more of you and less of me, right? And that's the thing that kept me safe. We also go, well, why can't I meet my goals? And why do I keep finding myself in these exploitive relationships? There tends to be a pattern of that again, because if your body found a sense of safety and exploitation, guess what it needs to feel a sense of safety? Expectation. And so you go, even that makes sense all of a sudden. Why do I keep dating the same person with a different face? Why are all of my bosses these tyrants? Why in my friendships am I the one who throws everybody the party and celebrates all of their things? And yet I sort of feel like I don't belong, exist, or matter, right? These are common fawning experiences. We're good shapeshifters. It's not always that we're good girls, although that happens a lot, right? What's the expectation? I'm going to meet it. So you like me and you know that I'm doing a good job. Sometimes it's like everybody's doing drugs, or they're all lying, or they're all gossiping. And these things are maybe outside of your value system, but the need to belong and to fit in, again, because it feels like it's survival at all times, we go, oh yeah, I hate that guy, right? You start betraying your own value system in order to belong. These are common fawning traits for the chronic fawner, right?
Yes. So let me ask you this. So for people that, and I see this so often, for people that, let's say, have been in an abusive context, abusive dynamic since they were little. And so, separate from that, fast forward for a second, let's say you grow up in a healthy environment. Let's start there. And then you get into a relationship that seems great in the beginning, but it turns terribly, horribly toxic, and you lose yourself during that relationship. And eventually you get to a point where you see the abusive cycle, you're able to gain objectivity, able to escape the relationship, and you have a frame of reference for kind of where you want to go and what it may look like when you get healthy, because your sense of self existed prior. It was stripped away, but will you ever be the same? No, because you've gone through something traumatic, but you know what it feels like to be healthy. It's something you can draw upon. What happens when you've had this long history since you were born, essentially, into this traumatic environment? When you are able to step outside of it, finally break the cycle, whatever the case may be, you have no frame of reference. So what do you tell people? How do you work with people who are trying to kind of let go of those fawning patterns? And as you said in your book, unfawn, right? What do you tell people in terms of how to get to a healthy place when they don't have that frame of reference and they don't have necessarily a value system that was ever theirs to begin with?
Yeah. I love even that you said they don't have a frame of reference. I was literally talking to someone before we logged on today about their process of this very thing. And we were like, it's like you don't have any skin. Because literally a trauma response is a defense, and our constantly hustling for approval and making sure was our defense. And when we drop that, we feel defenseless, like every nerve ending is exposed. So what I really want to let people know, even though it's not the thing most of us want to hear, is that this is the hardest, bravest work you will probably ever do. It does not feel good, right? So there's a lot of people that are going to sell you all kinds of ideas like, Jaime, if you do these 5 things in my program, you're going to be able to kind of override and jump through and, all is going to be well. And I go, I wish it were true. And if I had found it, I would be shouting it from the rooftops. But what I have actually...
This is why I love your work. And for those of you listening, this is exactly why I wanted to have you on, because it is hard and there is no 5 steps and there is no easy way. And you have to feel the crap in order to move. You have to. There's no other way around it. Period.
But as we're doing that, right? So basically what we're doing is we're either reorienting or, to your point, just orienting to ourselves maybe for the first time in our lives. And what we know is that the senses are the language of the nervous system, right? So we're getting this like cognitive, rational thinking brain that has all kinds of opinions about what I should do and how I should feel out of the way. And we're going, okay, I'm just going to orient to my body. And this is something that I give to basically any client that walks in my door, from Peter Levine's somatic experiencing work. It's using the senses to orient to your environment. And it's as simple as look around and notice what you see. What do you hear? What do you smell? What do you taste? And people will have a different sense that maybe they really connect to. For me, visually works almost every time. And I tend to like to orient to nature. Just doing that, right? We're animals. You think about the animal kingdom. They're connected to the earth physically. When was the last time our feet touched the ground? We're in override most of the time. So allowing our senses puts us in present time and place, also where most of us don't live most of the time. So I look around and I go, oh, I'm here. I'm in my house and it's a sunny day. And look at that color of green. And what happens a lot of the time is you see someone take a spontaneous deep breath. That tells me they're more regulated. That tells me they're feeling a greater sense of safety, because when we don't, we breathe really shallow. So practices like this, even if it's you're driving, it's mindfulness essentially. Can you notice what it feels like to have your hands on the steering wheel? Really notice. Do a little body scan. What do you become aware of, right? In every trauma therapy training I've ever done across every modality, we use this language. What do you notice right now? What are you experiencing? We don't say, what do you think about that? We don't bring people back up to this rational brain that goes offline when we're experiencing trauma. We go to the body and we go, what are you noticing? And here's the biggest gift, especially for fawners who want to do it right. We're so earnest. It's like, well, tell me what I'm supposed to feel. And I'm going to tell you that, right? Tell me what I'm supposed to notice. There is no right or wrong. You might notice my legs are numb. I got nothing. And we go, that's amazing. What's it like to notice that your legs are numb? We're inviting, again, the shift from solely focusing externally to focusing internally. And we're building this sense. And I promise you, if you start to practice these things in as gentle and compassionate way as we possibly can, this is the connective tissue to building every other thing that we're longing to do, whether it's I want a healthy reciprocal relationship, or I want to be able to have a voice at work. I want to be able to tolerate conflict. Well, this is where it begins. This is the foundation, is building a relationship to ourselves.
I love that. And, this is something that is, again, for people listening who are either in therapy or who are seeking out therapy. This is why it's so important, if you experience trauma of any kind, to find a therapist who is trauma informed. Because if you do not learn strategies from the very beginning to regulate your nervous system, and instead what you're doing is you're just talking about what happened to you, you get stuck in your head. There's no action taken, and you're reliving these things with no present coping skills. And the act of bringing yourself present in the moment with something that seems so small, like what do your feet feel like in the grass? What is the smell you're picking up on? What is the noise that you hear? Without doing that, you don't feel that you have a sense of control over your body. And right. And while it's scary to focus on yourself, right? I mean, this is why we worry, right? This is why we think so much, because as long as we're in our head worrying, where are we not? We're not sitting, right, with ourselves. And so we learn all these strategies that we can mask as, I'm a deep thinker, or, I'm overly, neurotic with organization, all of these things, which may work sometimes. But if that's your coping skill, what you're doing is making sure you're never present.
That's right.
And it's scary.
This is the other thing I noticed with my personal experience and all my clients, right? Listen, Jaime, I sat on a million therapy couches. I got 3 degrees in psychology. I could analyze with the best of them. I never forgot my story. I could tell my story. I could tell it on repeat. I was still missing in all of that context. And because I was a fawner, I did show up and I earnestly was like, oh, I need to do this kind of therapy, or I should read that book. But it was all in service of going from broken to better. It was like, I wanted to appear healed. I wanted to override this thing. I never actually, this is the scary part. We want to get over it so bad. The last thing we want to do is feel into it even more. It feels like you're moving maybe even in a wrong direction. But I promise you, God, it makes me emotional thinking about that. You're not. You're not. It's that old metaphor that we've used in mental health forever of peeling off the Band-Aid because it wasn't healing properly. You got to clean it out. It's going to feel worse before it gets better. It's all of that stuff is true, but it is a very radically different process. And to your point, I even extend that idea that like your therapist in the best case scenario isn't just trauma informed, they're trauma trained.
Yes. Yes.
Because
yes.
A lot of folks can be like, well, I know about trauma.
Yes. Yes.
And I go, but do you really what are the tools in your toolbox? And they should be able to tell you when you call, what sort of trauma therapies do you utilize? And listen, I'm not saying that any one is better than the other, but have one.
Yes.
Have one.
Correct.
Or several, right? Again, best case scenario.
One of the things that you also talk about in your book, Fawning, is the idea of inner work versus outer work. And so, inner work, we, kind of touch on, but outer work. And I want to talk about that a little bit, because this is, I think, the area that, I hate saying interesting because it's not based off anything good, but I find this part super interesting because when you are in a dysfunctional system and you start to change your patterns and you start to give yourself the opportunity to experience healthier outcomes, which makes it more likely, right, that you're going to engage in that behavior again. What advice can you give people who are working on the relationships with other people, but it's part of their prior patterns, let's say, and they're starting to make changes, and then people in that dynamic, they try to kind of push you back to your original positioning. It's throwing the entire equilibrium off balance. Everybody's out of sorts, even though it's healthier. What do you tell people? Because when I start working with people, I always say, now, jokingly, but I'm kidding. I'm not really kidding when I say throughout this process, there is a likelihood, and a good one, if that some of your relationships are going to change pretty drastically. And when you come in here, when you're done therapy, you may not be connected to these people. And I kind of prep them for that, to give them the kind of, and it's okay if you need to do that. What advice do you give people who kind of are in that situation where that's something that's really probably going to happen?
I mean, I basically say the same thing. I think absolutely, without a doubt, your relationships are going to change. Some relationships will have to end. So I've seen it often, particularly in friendships, female friendships. Some of my clients, they go, no, this friend is like my safest, best friend. And actually, as they start to have more of a sense of themselves and they're bringing more of their true self into the relationship, they go, this friend isn't like seeing me at all. They're not interested in holding space for me. I've been holding space for them for so long, thinking that that was reciprocal connection. And maybe they even go in and say, hey, I realize I'm doing all this work and it's probably going to change my friendships. And here's what I'm hoping for. And they find that even sometimes their safe, quote unquote, friend is not available for the version of them that they are becoming. And again, so heartbreaking on one hand, but on the other hand, we go, then that wasn't really the relationship that you thought that it was. And for me, this is where parts work actually, I think, is really effective, because as you're moving into changing, and to your point, there are people that want you to stay the same. Fawning doesn't just allow us to feel safer in the moment. It props other people up. They don't want that to stop. They go, oh, you're going to swallow all the shame. Oh, you're going to do all the fixing and the caretaking and the cleaning up the mess. And fantastic. Like, people don't want us to stop. It's like, and so when we do, we tend to hit that. Again, it's our fear of conflict our whole life. And now we go, oh, it's unavoidable. It's unavoidable. I can't keep doing this at the cost of myself. And here's the thing I say, your relationships are going to change. And in my experience and in my client's experience, having a true relationship with yourself for the first time in your life feels so good. It feels so much better. The level of freedom and autonomy and agency and creativity and all of these things that we're lacking. When you experience that, honestly, anything that gets in the way of that it pales in comparison. Right? Once we really get in our body that this feels so much better than the way I've lived for so long, we wouldn't keep doing it if it wasn't worth it. You go, okay, I get it. I'm going to go back to those old relationships. Nobody does.
Yeah. Yeah. I mean, listen, we hope that the people we love who are closest to us will shift with us and support us. And listen, that absolutely happens.
Yes.
I think obviously the harder relationships are the ones where the person not only benefits from it, but realizes they benefit from it and simultaneously wants to keep you in that position.
It's
right. Because
it's heartbreaking. So grief, when I talk about this work, grief is a big piece of that, because often we not only have to grieve relationships in real time, but we grieve what we've been missing maybe our whole lives, and what we've kind of dressed up or we've minimized to say, well, it wasn't that big of a deal. We have to feel actually what we've been missing.
Yeah. Yeah.
But again, it frees us up for real relationship to ourselves and others.
And to know that, and to know that you're in control of your behavior in those relationships, that it's not contingent on maybe they'll love me more, or maybe they won't be mad, or maybe I can make them comfortable. It's not contingent on any of that. There's no strings attached. It's truly reciprocal, and it's such a freeing, although scary at first, but freeing at the same time. And that fear that you have, I always tell people it's not so much fear. I think that's the label we give it. Discomfort, yeah, but not necessarily fear. But again, we can't just, unfortunately, and we wish we could, cherry pick the emotions that we want to have. Right. We have to feel the whole gamut of things.
Right. Yeah. Yeah. My husband says to me all the time, it's my favorite thing, there are no shoulds in this family. And every time he said, I'm like, really? Really? I don't have to earn your love and your respect and he's like, no, you get to be you. And also I get to be me. And it's so freeing.
Yeah. Yeah. And that's that breath, and you said it in the beginning, you hear that breath that people sometimes take, and it's probably the first one they've taken in a really long time.
Yeah.
It's that, but magnified, I'd imagine,
Yes.
by a million.
Yes, exactly. That's a great
Yeah.
way to think about it.
Yeah. So your new book coming out
Yeah.
September 9th, pre-order now. I will put the link in the show notes. What, if you could pick one thing, I know this is a loaded question, that you would love for people to really take from this book, what would it be?
That they're not broken, that they're powerful. Their body did the best it could do to take care of them. It probably did an amazing job, and they still deserve more freedom. And there's nothing wrong with them if they haven't found it before now. I'm going to tell you right now, even the mental health field has failed you, right?
Yeah.
And it wasn't maybe intentional. We didn't know what we knew until we did, but we know it now. And
Yes.
so you are not broken, and the change that you've been seeking can happen.
I love that.
Yeah.
I love that. Where can people find you? I want everybody to go see your work. It's so good.
Ingrid Clayton is my website, and all my social channels are there, but I'm pretty active on Instagram and now Substack for longer form stuff. What else was I going to say? Yeah, come join the community that way. And I really appreciate pre-orders. All authors know that that's like, it's a game changer in terms of how many people end up getting access to your work. So I'm really grateful for that, and grateful to you for having me today.
Oh, this was great. Like I said, I'm honored to have you on. I think you are a wealth of information, and you just speak about it in a way that is just, like I said, nuggets of information that people can really just relate to and take with them and understand, and without the shame and the judgment and all that. So thank you so much for taking the time to speak to me. We will definitely do it again soon. And, again, September 9th, pre-order now, Dr. Clayton's book, Fawning, and definitely follow her on social media, particularly Instagram, because she just posts some wonderful information. So thank you so much, and we will talk again soon. Thank you for tuning in to another episode of Next Up Narcissism. I hope you found it useful, but most importantly, I hope you found it validating. Want to work one-on-one with me? Visit my website at drjamiezuckerman.com to book a personalized coaching session, and be sure to check out my on-demand workshops on topics like co-parenting with a narcissist, life after leaving, anxiety management strategies, and more. Again, that's drjamiezuckerman.com. You'll also find links to my interactive workbooks, merchandise, resources, and newsletter sign up. Next Up Narcissism is as much your podcast as it is mine. I want to hear your feedback and what you want to hear. So make sure to leave a podcast review wherever you listen, or send an email to nextup@drjamiezuckerman.com. Again, that's nextup@drjamiezuckerman.com. Be sure to subscribe so that you never miss an episode. And as always, thank you so much for listening. Make sure to tune in next week to see what's up next on Next Up Narcissism.